This computer. Good morning, Dr. Tom Larkin here with Dr. Mike Subiak on the Phoenix Dental Project category of dental hygiene. So one of the things I want to talk about this morning, Mike, would you please explain to me PPP, the Payroll Protection Plan? Wow, has that thing morphed a few times?
Well, yeah, I'm fine to talk about it today, but it'll probably change by tomorrow.
Yeah.
But the idea is, I think the whole point behind the whole thing is that the government really doesn't want to see a whole bunch of people unemployed and bringing the numbers up. And then when we get back to work, they want us just to hit the ground running. So I think those are all fine and sort of noble ideas. But dentistry is so different from so many other industries. We just can't, the whole idea was, okay, if they give us money, will we bring everyone back in and employ them? In a dental office, one is it would be reckless to do that right now, and nor legal. And so the program really hasn't really been in sync with recommendations from different states.
And I think in particular, we talked about this, I think it has kind of singled out dental hygienists, okay? Because they were the first ones, because they were considered non-essential, that pretty much across the board lost their jobs, went to unemployment. So the concept now in the PPP is now you have to hire them back, and they're a different category within the economic strata of the dental office. What are they to do for the 8 weeks? And it's like, we all know that this is not going to be a light switch when the practices start back, that, the practices are going to have to work their way back. The dental hygienist is in a really tricky spot.
For sure. And I find that there's so much uncertainty as far as how that coming back to work is really going to happen. Is it going to be, if we get a hold of how to make sure we can comfortably and safely treat everyone, it's possible that hygiene is going to be the big, you better open up your doors pretty wide, because we're going to have so many people that are saying, hey man, I had an appointment in May and now my teeth are totally grungy, and they just want to get right back in there. Or there's going to be people that are so freaked out by the whole thing, they don't want anything near it. Or I don't know, you look at states like Oregon, where they've talked about June 15th is when everyone's shut down until.
Wow,
and so
that's aggressive.
So what does the future hold in California, where we have a good and a bad situation as far as a dental owner of a practice? It'll be easy to get my hygienist back, because unemployment, even with the extra $600, it's less than half of what they would make on a weekly basis working. Right. But at the same time, that puts a lot of pressure. I can't really have them come back and, I don't know, send out postcards to people, right, or whatever for $50 an hour. I don't know. It puts us all in a weird situation.
It is. I think it's so completely unique to dentistry. It's not what it was intended. Maybe the restaurant business is different, but I don't see. And the other thing too, I don't see this. There's not much of a rescue in that for the owner. For the owner of the practice, right? I get the whole thing of protecting the payrolls, and it would have been great if they could have done it within 7 days of the lockdown, and everything stays intact. But people have scattered to the wind, and now you can bring them back, and then you and then the minute you're funded, you hit the clock and you got 8 weeks, and that just seems weird.
Yeah. So everyone, the money has to be spent in 8 weeks. By June 30th, everyone needs to be back in place, or at least the same numbers. Doesn't have to be the same people. So, but you need to have everyone in place by June 30th. The money has to be, we have 8 weeks to spend the money. If not, it turns into a huge loan for us.
And they shortened the span of the loan from 10 years to 2. I don't know if you knew that.
2 years.
Yeah. So it's like you pay it back. What I thought initially, this was my thought, because they were so aggressive and so generous with unemployment, I thought that this money would be kind of credited at the end as you went back to work. Hey, here's a little something for your payroll specific to help you get started back. That's what I thought it was going to be, but it's not that at all. Yeah.
Yeah, it's going to be really interesting. I know I don't know, in trying to make things easy and simple, it of course complicates things, and it puts a lot of decision making onto the owner's back. And so I've taken it seriously as trying to figure out what's the best thing, both for my employees, but also for making sure the practice is viable. But I think it's in Germany where they just paid people their wages, like the government.
Yeah.
They kept the employers out of it.
Yeah.
And I think something like that would have been simpler,
Right.
because I think what this is really happening, what this is going to be, is sort of a money grab that could end up turning out to be really good for an owner,
Yeah.
or could be good for the employees, or it can be a total nightmare for either or both. So there's there's really nothing in that is set up to have us come back maybe partially. So let's say we can do some non-aerosol restorative
Right.
or whatever. It's set up really horribly. And then also, I mean, this again, my California take on it. People make more money out here because the expenses are higher. So the limitations they put on things, or even with the unemployment rates, everything is too low. So I have associate dentists that, they with the PPL, they'll cover up to what would be equivalent to $100,000 per year, and dentists generally make more than that. So it's going to be tough on them. It's going to be tough on hygiene. It's a gamble for the owner, and most dentists, really want to do the right thing. I mean, I hear them talking and struggling with this whole thing, but the last thing you want to do is have a dentist be really generous, and then when this loan gets due in 2 years,
Yeah.
and because we deal with other things. Okay, so we come back. Let's say we come back May 15th. We're back and everything's great. Then all of a sudden, something happens, and we find out that there's some case that comes out of a dental office or something, and maybe then all of a sudden dental offices are shut down again. Again, the owner can be completely wiped out or have to continue to pay wages. And so it puts us in a really tough spot financially to try to make it all work out.
Yeah. It's a tricky thing. And once again, this is about as complex a situation that's ever happened in this country. I mean, it's historic. So one other thing I want to chat with just real briefly is I saw a comment, and it was an emergency room physician. He was talking about intubation. He was talking about the scarring and the ulceration of the trachea in the intubation process and having a tube in. And of course, my mind was just like immediately going to that periodontal pathogens, scars, oral systemic connection. Nothing like when we talk about when your gums bleed, you have a connection. Well, how about having a giant ulcer in your trachea? And this whole concept of the periodontal pathogens leading to pneumonia, and these people are succumbing from pneumonia. So where are these outliers? Why? Because you see it in the news every night. This person, this perfectly healthy 40-year-old, blah 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 blah, they died. And I just really really think the combination, and we'll never know, but I think the periodontal disease and obstructive sleep apnea are significant risk factors in this whole conversation. That when we go back, I certainly want our hygienists coached up to have this conversation of the fact that this is a whole nother reason why we need to look at your sleep. And this is a whole nother reason why you need to comply with this perio and get those pathogens out of your mouth.
Yeah, for sure. I maybe because I'm just kind of an airway geek and all that, not that I can diagnose someone just by looking at them, but in a way I can really look at someone's facial structures, and it gives us so many clues for upper airway resistance syndrome or sleep apnea. And so, yes, every time, like, John Prine just passed away,
Yeah.
and he had all sorts of complications with health over the years. But I can look at a guy like that, and it just, he has sleep apnea written all over him. Same with Boris Johnson.
Yeah.
If that guy didn't have sleep apnea, I'd be totally surprised. But doesn't have to be just big, heavy guys, but it's people with skinny noses, things, because they have shown also that there's a um, article I wrote about how Viagra can be a really big help for fighting off our coronavirus, because of the nitric oxide it produces and relaxing the blood vessels in the lungs, so we're able to exchange more oxygen. And so when we
That's the
breathe,
breaking news of the week.
yeah, I know. Probably whoever broke that probably has stock in Pfizer, but you can hardly. You always have to look at the source of these things. But yeah, the idea that because with sleep apnea, we tend to do more mouth breathing. It bypasses all of the cells that are creating nitric oxide
Right.
in our nose and sinus. And so, yeah, they're definitely, I think the whole airway thing is huge.
Yeah.
And then, yes, we have these periodontal pathogens that we're inhaling, breathing in and out, and we're dealing with, this is possibly also a huge inflammatory response thing going on, and yeah, ripping people up, intubating people and stuff. And I even, I've read articles recently about how putting people on ventilators just may not be the right thing that we're supposed to
Correct.
do.
Yeah.
So, there's just so much stuff going on there. But if this doesn't signal to everyone that if there's one goal we should have for the year 2020, it's to get ourselves healthy,
Yeah.
get our patients healthy,
Yeah.
and then get ourselves healthy financially and our practices healthy financially, so that we can weather these things. Honestly, if you are healthy, both physically, mentally, and financially, this can be such a nothing for you. But all you need is one of those to drop out, and then we're had. So
Right.
I really think we need to take this as, like I've said, this is the warning that of when something else that comes up that's bigger, we can't let this thing happen again. We have to take this seriously. And we'll find out more about what's really going on with how our body's reacting with the coronavirus. But we all know it's going to come down to our body's ability to fight this stuff off and be healthier. So
That's pretty
it,
profound. I mean, if I was a 35 or 40-year-old dentist, and from what you've just said, these are the lessons that will serve you the rest of your life if you pay attention, right? But you got to pay attention.
right. Our generation, our whatever my generation is, but we just really haven't had huge challenges in our life. We haven't had a World War II,
Right.
rationing, and really suffering and changing our lives, sending the men off and women taking on industrial positions for the first time in the country. This is our World War II
Yeah.
time, and we will be. I I remember my grandmother when she passed away. She always was funny about money, and she'd never talk about money, and it was very private, and I had no idea. But when she had passed away and we were going through her stuff, we found dollar bills and things stuffed into every nook and cranny in her house.
Yeah.
And my mom said, "Oh yeah, she just didn't trust banks." I'm like, "What's there not to trust about banks?" And then years ago, when the savings and loan crisis happened and people were lining up in front of the bank to get money, I mean, that's one I was wondering about. This is, we all hoarded toilet paper.
Right.
Were we going to have a run on banks to get dollars? And that didn't happen, thankfully. But anything can happen. So I think this is going to make us way stronger and smarter. And
Yeah.
that's why I hate to see any sort of death or families broken apart or the financial hardships. But generally, this is going to make us better all the way around.
For sure. All right. Well, I appreciate your time. I know you're super busy, like we all are, kind of juggling these things. And we'll try to do this on a regular basis, kind of in real time as we kind of march through this together. So thank you for your time. I appreciate it.
Oh, sure, bet.